Hello guys, welcome back to my channel MedPharmaco Essentials. Myself Aishwarya Vernikar, Doctor of Pharmacy. So this video is mainly dedicated to those who are diabetic or for those who are taking care of a diabetic patient in their home. So before going to that, let me just tell you what is the main problem in this diabetic patients. Usually, when we eat our food, the carbohydrate part of the food will be converted into glucose, as we have studied, and that glucose will be used in the form of energy by our body. Now, this glucose, before it is used as a form of energy, it enters into the bloodstream. And insulin is the main hormone which is secreted at that time. The insulin in the liver, muscle, fat tissues will stimulate the cells to take up these glucose molecule from the bloodstream and store it in the form of glycogen and release it whenever it is necessary. So what happens, our blood sugar level will be maintained due to this insulin hormone. Now in diabetes condition, what happens? This insulin, either it is not produced, or if at all it is produced also, the patient is resistant to it. So this external insulin therapy will be prescribed.
So the first thing we need to do is keep our hands hygienic whenever we are giving insulin therapy. Wash your hands properly, see that you maintain the hygiene. Second, whenever you open any insulin pen or insulin vial, just mention the opening date on it. Because the lifespan of an insulin after you open it is usually 28 days. So it will be good if you mention the opening date in the vial or in the insulin pen. You have to remember is whenever you open that cap of the insulin pen, you can see that the insulin you can see here on the top, right? So when you see the insulin, if you feel that it is milky or cloudy appearance, usually intermediate acting insulins are having an appearance of white and cloudy kind of appearance. So if you feel like that, just roll that insulin pen between your palms for 3 to 5 times. Just you can roll until it becomes clear. Do not shake it vigorously. Do not do those kind of things. Just roll it between your palms. Next here in A diagram, you can see that you have to just open that paper covering of the needle. After you open that, just screw it inside this needle top. After you screw it off, just remove the cap of the needle and the inner cap. There is another cap inside which you have to remove and discard, whereas the outer cap you can keep it with you. Next here you can see in the next step, you have to just turn and set that dose knob to 2 units. Press it at the bottom, so that you can see there is insulin drop appearing in the top of the needle. This is mainly done to the air bubble if anything is there. Next step, we have to adjust how many units of insulin is prescribed to us. We have to just rotate that dose knob and we have to adjust it, either 10 units, 12 units, whatever will be prescribed, we have to adjust there. Selection of the injection site. Usually abdomen is mostly preferred injection site for the insulin. Always you have to see that you maintain a distance of 2.5 centimeter from the belly button and you can inject in any of the area which is ticked in the green here. You have to take precaution that you don't inject the insulin repeatedly in the same place, because when you inject repeatedly in the same space or same place of the abdomen, the patient can undergo a condition called as lipohypertrophy. In this, what happens, the tissue gets hardened there, the blood supply will not be proper in that area, due to which insulin cannot act properly. So you have to live at least for 3 months if such thing happen. Leave that site for 3 months and then you can use that site again. The recommended injection sites for the insulin is the abdomen, which is marked in blue here, as well as the front and side of the thigh can be used. When you see from the back, the upper and outer arm can be used, or the hip muscle can be used, or side of the thigh can be used for the injection site.
A part of the picture tells you how to hold the insulin pen. Next, the site where you want to inject the insulin, just pinch the area, have a gap between your thumb and the first finger. Then slowly perpendicular in the 90 degree, you have to inject that insulin. After injecting, just release the pinch and wait for 5 to 10 seconds to prevent the leakage of the insulin from the injection site. After doing so, you need to close the needle with the hard outer covering that you had removed at the first, and then remove the needle and put it in a hard container. The process is almost same when you're using vial and insulin syringe. You have to first wash your hand, keep everything ready. Next, if you see that your insulin solution is cloudy, then you have to rub between your palms. Then after opening the cap of the insulin vial, you have to just wipe it with the alcohol swab, and then you have to pull the plunger down to desired unit. Whatever amount you want to inject, you have to pull it down and perpendicularly inject it to the vial. So after you inject to the vial, you have to push the plunger down. As you can see in the 8th figure, you have to invert the vial and pull the plunger down to the desired unit, filling the syringe. And in the 9th picture, you can see that if any air bubble is there, you have to just remove it, inject the insulin and discard it. Main thing is the storage of the insulin. So whenever you're traveling, you don't know how to store it, right? So you get a thermostat pouch which will help to maintain the temperature. You have to just remove the black cover whichever is inside, and you have to put it in a water and just squeeze and remove the water. The crystals in the black bag will help to maintain the cool environment, and storage of insulin is possible. Insulin is a protein. So insulin, when subjected to very high or very low temperature, have the chances to get degraded. So you have to store it very carefully. Storage of insulin, when you see not opened insulin, like you have bought it from the pharmacy and you have just kept it, so you have to store it in a 2 to 8 degrees Celsius in the refrigerator. Once you open the insulin, you have to store it under 30 degrees Celsius, and keep in mind, do not freeze the insulin. If it is very cold also, then just remove it, bring it to the room temperature and then inject yourself. Coming to the insulin storage, when it is opened, as I said, you have to write the opening date, and for 28 days you can use. You have to see that the 30 degrees Celsius is maintained. You no need to refrigerate it. Speaking about the changing of insulin needle, yes, the insulin syringe need to be changed after 2 injections. Some people use it again and again to save the money, but no, after 2 injections you have to change the insulin syringe. And some people try to wipe that insulin needle with the alcohol. No, you cannot do like that also, because again and again rubbing with the alcohol, it will remove the silicone layer of the needle, and hence when you inject it, it will be very painful for the patient. Next, insulin pen devices needle have to be changed after 3 to 4 injections. This was all about the brief information. Thanks for watching the video.